welcome to an In Conversation With. My name is Emma Smith. I'm the project manager with Empowered Conversations, and that's a project of Age UK Salford. Delighted today to be in conversation with Emma. Thanks for your time, Emma.
Thank you.
If you haven't joined us for one of these before, I'm going to give you a little bit of background on Empowered Conversations. I'm going to hand over to Emma for her presentation, and then we're going to make sure that we have plenty of time for Q&A. Any questions you can pop into the chat and we'll make sure that we pick them up at the end. Chat's just on the right hand side of your screen. So if you haven't come across Empowered before, we empower families to live as well as they can when they're affected by dementia. And we do that by delivering communication courses. We have Empowered Conversations, Moving Beyond Words. We offer dementia-focused therapeutic support through Empowered Carers. We do these webinars and we have a few groups as well. So that's the work that we do. It's across Greater Manchester and generally online. Some of our support can also be on the telephone. That was literally my introduction. So I'm going to hand over to you now for the presentation, if that's okay.
Thank you very much. Yeah, thank you everyone for having me. Just to back up what Emma was saying then, I've accessed the Empowered Conversations as both of my parents have got dementia, and I cannot stress how important and how life-affirming and life-changing these courses are. Although I'm providing one today, I go on them regularly. So please access them if you can. Bit of background about me. I'm a Mancunian, as you can tell. I am the patron of the Society of British Dental Nurses. I'm also an ambassador for the Mouth Cancer Foundation. Mouth care tends to be a subject that people really aren't interested in. I often get told, oh, I know how to clean a mouth. A mouth is important. It's all right. Yeah, we need to keep it clean. Mouth care can be really, really challenging. So what I thought we'd do today, and there's some horrible slides here, everybody. And I make no apologies for that because I need to get the message out there. It's basic oral care we're going to look at today, getting in the mouth, and why it's important for us to do this with anybody. And that goes from a newborn right the way up to if somebody is end of life, last hours of life. So let's crack on. This is not a very nice slide I'm going to show you after this one, but it was a case study and it is quite graphic. The photo. An 80-year-old man with a history of dementia and Parkinson's disease is admitted to hospital from a nursing home with a 2-day history of shortness of breath. He was unable to provide a history due to his dementia, although the possibility of a swallow of the denture was suggested by staff. Examination revealed a reduced air entry on the right side, and chest x-ray showed a collapsed lung. Basically, long story short, because he couldn't lie down flat because of his breathlessness, he was put down for palliative therapy care, and he died the following day. And this is his post-mortem photo, graphic photo alert, folks. You can actually see the denture there, and this was from the post-mortem. There it is. I think the next one will show you it a little bit better. This guy was not able to tell anybody that the denture was there. It must have been a bit like locked-in syndrome, where he couldn't actually verbalise. And it horrifies me. Anybody who's seen my talks before will know that I show this slide quite a bit because it is absolutely shocking. My argument with this is that why was it not noted that his denture had gone missing? This is horrific, but why was there no mention of his denture going missing in the notes? Or, you know, people should have noticed that his denture wasn't there. If his hearing aid had gone missing, or his remote control for the telly, people would have noticed that. Mouth care is not given the credit that it is due. Also, when we lose weight, and it's happening with my mum at the moment, because her appetite is going, she's got no interest in eating at all. She is losing weight, and as you lose weight, your clothes go loose, but also dentures go loose as well. You might have noticed that. So it is really, really important that staff, carers are aware of this. I don't want anybody else dying this way. It's a horrific way to go. So basically we're saying, let's put the mouth, or the gob, as we say up here in Manchester, back in the body. And it's treating the mouth with the respect that it deserves. And it does deserve respect. It is the gateway to our soul, our body. Everything goes through our mouth: food, air, a smile, a kiss. It is so, so important. So when I say to you the mouth, and we call it the oral cavity, people who work within healthcare, it's all these things. It's the lips, it's inside the lips, it's cheek, it's teeth, it's gums, front bit of the tongue, floor of mouth, below tongue, upper and lower jaw, salivary glands, bony roof of the mouth. So when you saw this talk today, you might have thought, well, she's going to talk about teeth and dentures. Yeah, I am, briefly, but I want you to start looking at the whole mouth holistically as a part of the human body. And until we treat the mouth as part of the human body, we're not going to get anywhere with mouth care, because it is treated as a different entity. So when we think mouth, we think health. If I was with you today, I could look in your mouths and have a general idea as to how healthy you are. So we can look into your mouth and see how healthy you are. Basically, it's a two-way relationship. We can look in your mouth and see if you are anemic, you've got TB. There's loads of different ways we can see your health by looking in your mouth. It's a two-way relationship. Poor oral health being linked to so many things, and this is really important with people with dementia. I know my dad keeps getting recurrent chest infections, all he was doing. We looked at thickening up his drinks, but also improving his oral health. Although I'm Mrs. Oral Health Educator, with your own parents, it can be, you sometimes forget to notice the little things, the things you do as a job. Chest infections are a biggie. So if the mouth isn't clean, they can get recurrent chest infections. They can get something called aspiration pneumonia. The same with a stroke, that can happen because the swallow can go with a stroke. It's been linked to heart disease, uncontrolled diabetes. So if you can't clean somebody's teeth and gums, it can affect the blood sugars as well if they're diabetic. We've linked it to everything. There is some studies on poor oral health and Alzheimer's. So the bottom line is, I'm saying to you is, think health, think oral health. So important. Poor oral health can cause many things. Behavioural problems. I know I've got a chap at the moment who keeps hitting his head against the wall because he's trying to say, my tooth's hurting. Inability to eat and speak. Diet, nutritional and hydration problems, and weight changes. I know if somebody isn't eating, they tend to do everything else before they look in the mouth to see if there's a problem with the mouth. You're going to say to me sometimes it's difficult to look in the mouth, and I 100% get that. I'm going to tell you some tips on that later. But if they're not eating, if the mood's changing, there's a subtle change, it could be the mouth. Problems with social interactions is a problem as well. They might feel that they're aware. And don't, just because somebody's got dementia, there's different levels of dementia in different stages. They still can be bothered if their mouth smells or they've got a problem with the mouth. It can make it difficult to have an intimate relationship with somebody because of the problems with the mouth. And when I say intimate relationships, I mean speaking to your daughters, your sons, giving them a kiss with your grandchildren. They could be, really aware of the mouth. Medical complications, like I've said, aspiration pneumonia. And please, 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 this last one is so important, poor quality of life. If you've ever had a toothache, or you've ever had a wisdom tooth out, or a little spot in your mouth where you bit your tongue, you know how painful that is to yourself, and it affects your day. You're in a bad mood for the day. Imagine that right the way through your life if there's some problem in your mouth. So my argument is, would you ignore this? If your relative, if your patient, if your resident had their eyes stuck together like this, congealed like this, you would move heaven and earth to get this sorted. I hope we're all agreed on that. I actually struggle looking at eyes like that. We would do something about that. And yet we have mouths like this. The chap to my left here, actually it's a lady on the left, you can see she's got a build-up on her lips. At the corners of her lips here is something that's called angular colitis. It's a little fungal infection, and you might notice it with whoever you're caring for. It gets right at the corners here, and often when we say open wide to do oral care, it can crack, and that can be sometimes why they're a bit resistant to oral care. This lady had a stroke, so she had what we call PEG pneumonia, and she was being fed through that. So she wasn't actually using her mouth to eat, which sometimes does happen if they're not eating and drinking as much as they would be normally. And this is what happens. All this on the lips went right the way back down her throat. So this is highlighting how important, even if somebody's nil by mouth or not, or a modified diet, we still need to clean their mouths and keep their mouth clean. And I'll tell you how to solve this shortly. The other slide is somebody who's just not got any saliva. And I'm not decrying, I'm not saying it's just no saliva. Having no saliva in your mouth is a big, big issue. And I would argue and I would suggest that many people that you're caring for will not have saliva in their mouth, or they'll have a limited supply of saliva. That mouth has got no saliva. You can actually struggle to see where the lips begin and end. The teeth are starting to decay because saliva keeps the teeth healthy, it keeps the oral cavity healthy, and the tongue is fixed. Back to social interactions. If somebody's got a mouth like that, it would be painful to give somebody a kiss with that mouth, to say goodbye if it's end of life, if it's a time when they're passing. So no one should be having a mouth like this. If this was anywhere else on the body, this would not happen. Tissue viability would be involved. They would be being dressed. People would be monitoring it. This gets ignored, and that's why I sit here doing talks like this regularly to try and highlight this. This is just a case study, and Betty McGraw died after a denture had to be surgically removed when she was admitted from a care home in Scotland. And hospitals are trying to get oral care classed as a sixth harm in long-term hospitalisation. The coroner concluded, although poor oral care was not the cause of her death, it was a contributing factor. Now, recently, I think a couple of years ago, or maybe more, 2020, I think it was, I might be wrong, 2022, there was a case for the coroner in Bolton where oral care had not been carried out in a residential home, and the coroner actually stated that lack of oral care caused her death. So what I'm asking you to do, anybody who is caring for anybody in residential care or in hospitals, please make a note of what you are doing. If you cannot get in there to clean the mouth and you're struggling to get in because they may be resistant to oral care, number one, you keep trying. You try every day. You try as many times as you can to get oral care performed. If not, you need to document that you are struggling to do it. Because there are some mouths, I'm not the tooth whisperer, I can't get in every mouth. There are sometimes I struggle to get in residents' mouths, but I'll keep trying. But I know that if we can't get in to do their oral care, it could cause or contribute to their death. It's a really important fact, that, and a really important point. The wonderful world of dentures. The lady, I always say the lady on the right is my mum, but it isn't, honestly it's not. Those dentures on the left, again, anybody who's heard me talk before will know the story about this lady. This lady came in for new dentures. They had to actually be cut to get the dentures out because they'd been in too long. And once we removed the dentures, there was maggots living all underneath the lower ridge. In my career, I've seen maggots under dentures 2 or 3 times. It's a horrific thought. And that is still happening at the moment because people aren't cleaning underneath dentures. So please, please, please clean dentures. Dentures are as important for me as natural teeth. And I thought for this talk we'd look at dentures because dentures have changed in my lifetime in healthcare. So when I first started, because I'm probably older than a lot of people on here, we had the plastic ones. They're acrylic, but let's call them plastic. My granddad had a set that he took out and popped in the pot by the bed. We've now got full and partial dentures. These are the partial dentures at the bottom there. So they've got the odd tooth on. Because, believe it or not, we are keeping our teeth longer. We are keeping our teeth longer. And then if you're dead posh, there's implant retained dentures. Some of you might have seen them where they actually click in and click out. Now, those press studs actually in the jaw, you can see there, they need cleaning like normal teeth would need cleaning. So imagine them as teeth. If you don't clean those, they literally will drop out, and they're a titanium screw that is actually drilled into the bone. They are brilliant dental implants, but they need cleaning as much as, probably more than normal teeth, to be honest with you. So I just thought I'd tell you a little bit more about the dentures that you might be being seen. So the wonderful world of dentures. Toothpaste is not recommended. By the way, take what I'm saying now as far as toothpaste goes with a pinch of salt. These are the guidelines about cleaning dentures. If you've got somebody with dementia who literally likes to do the same thing all the time, don't change it. Don't say Emma Riley said you need to do this. If they like what they're doing, leave what they're doing. But this is the guidelines that I've got to go through with you. Why is toothpaste not recommended? Well, toothpaste is quite abrasive. It will actually scratch teeth. Oh, I say scratch it, it's abrasive, but it will actually scratch the denture, the acrylic of the denture. So what we do is we actually just use liquid soap or denture cream cleaner. You're going to say to me, well, can't they taste the soap on the dentures? Well, you don't taste it on your spoon or your plates or your cup if you rinse them correctly. You can see with my hand, manual cleaning is a must. So a nail brush and give them a really, really good scrub. Obviously, one nail brush to each patient. Denture soaking solutions to be used as per instructions. You can see the Steradon, it says 3 minutes. And I know that they're being left in their solution overnight. I know that for a fact. Again, I'm just telling you what's written on the tube of the Steradon or whatever you're using. I'm just highlighting that I don't think anybody's actually read how long it says to leave the dentures in the denture solutions. Is it going to be detrimental to the dentures? Probably over a long, long period of time, but it's nothing to lose sleep over. But I would prefer that you use them as per instructions. If they've got thrush or a fungal infection in the mouth, we'll actually soak the plastic dentures in some like Milton solution, like you clean a baby's bottle. If you've got the metal ones, we put them in a bit of Corsadil chlorhexidine mouthwash. Sometimes if you speak to the doctor or the dentist, you might be able to treat the denture with the antifungal treatment. I'll come into that later. And then there's different guidelines on it, but we put leaving plain water overnight. So it's really important. Also, if you're cleaning dentures, I've not put it on the list, fill the sink up, put some water in before you're doing it. Not do what I did when I very first started at 15, which was doing it in a sink and drop the dentures and they broke. Sounds, you know, you should know not to do that, but I was only 15, folks, so it's a long time ago. Saliva. Oh, I could go on for another hour about saliva, but you'll hate me by the end of it. But saliva is so important. It keeps the mouth really, really healthy. Saliva is 99.5 or 8% water. The rest of it in it has got all these enzymes in it that keep your mouth healthy, really healthy. It lubricates. It helps us taste our food. It's antibacterial. It regulates our oral pH, and it actually can help protect the teeth. So there's a picture here of a guy. So at the side of your face, each side, you've got these two, they're called the parotid glands. You know, if you have some lemon or anything, you can feel it's tarty. That's the one that if you look at a drink or you look at food, that starts putting saliva into your mouth, and that mixes with the food and helps with digestion. Your others underneath your tongue and underneath your jaw secrete a thicker saliva. So if you care for anybody who is nil by mouth or is just on the Ensure drinks now, you might have noticed that the mouth is getting a little bit stickier than normal. It's because they're not using the parotids, because that's where the nice thin saliva comes from. I hope that makes sense. It's more technical than that, but that's all you need to know about this. There's different saliva glands for different reasons, and saliva is really, really important. If saliva goes for whatever reason, this is what happens. You get a dry, rough tongue. The mouth can be painful sometimes. Oral infections, lips sticking to the teeth, taste disturbance. They might complain that they're not tasting the same. In fact, I've noticed with my mum that she's putting more sugar in her tea and coffee because she's craving that taste, the sweet taste. And you will find that they actually put more sugar into their diets because they want to feel and taste food. They'll have a bad breath, sticky, dry feeling in the throat, trouble chewing and swallowing, tasting or speaking. Some of them will actually report that the mouth feels hot. There's a burning sensation in the mouth. They get cracks, dry feeling in the throat, and they get cracked lips and corners of the mouth, like that angular colitis I told you about before. What causes a dry mouth? Well, diabetes. Actually, a lot of people get diagnosed to be diabetic because they'll say, I'm thirsty all the time and my mouth's dry. It's one of the main telling points for being a diabetic. Chemotherapy can give you a dry mouth. Head and neck radiotherapy, which I hope you won't see too many of. 400 drugs can cause a dry mouth, which is 90% of all cases. So I would argue that at some point, the person you're caring for will have a dry mouth. I'm on thyroxine, gives me a dry mouth. Oxygen therapy will give you a dry mouth. Mouth breathing, I've put that one down because it's getting colder now, which should be, it's pretty warm today, but it's getting colder now. The radiators will come on, and it actually gives us a dry mouth when we wake up in the morning. And enteral fed, that's being fed through the tummy or in through the nose. The mouth isn't being used as it was, so it'll go dry again. A dry mouth is a condition, not a side effect. Think back to the picture I showed you with the eyes. If they had dry eyes, they would get eye drops. The same applies with the mouth. So speak to your GP, speak to your dentist. They will be able to give you some advice. People on wards or in residential homes will probably hear about these products. You can get artificial saliva and lubricants. Ice chips, probably not so much where you are working or at home. My mum likes to, she loves an ice cream, but she'll have a nice lolly. That'll keep her mouth. It'll feel moist, it'll quench her thirst, but it won't lubricate the tissues. Sugar-free gum is another one. You might laugh and say they won't chew gum, but some of them remember when chewing gum came over in the Second World War with the Americans, so they will chew chewing gum, but I would prefer to manage it with oral gel. If I've got a dry patch of skin, I won't just keep throwing water at it. I will lubricate it. I will massage some moisturising cream or gel into it. So please, please, please ask whoever is a prescriber or your GP for an oral lubricant gel. It can be applied to the lips and inside of the mouth, and I'll give you some tips on how to do that shortly. This is a case study before and after of a resident in a nursing home, an older, vulnerable, medically compromised female. She was living in a nursing home, fully dependent on her carers, non-communicative, poor to no oral care delivery. So there's no oral care being delivered. Staff were informed that this was neglectful and unacceptable. I mean, looking at that picture, that's not been done for some time. Discussion around lubrication and debridement of residents' lips and oral cavity. We put an oral care plan into place and a review completed. This is 4 days later, folks. Look at that. We should put 3 days later on there. Look at that. It's absolutely, apart from that little bit on the top lip. This lady did have a little bit of challenging behaviour depending on the time of day. So we had to sort of work with her when to do it. But I hope you'll agree there's a massive big difference between that and that. With a little bit of perseverance. So the gel was applied and then the teeth were brushed. I mentioned oral thrush before. These are some pictures of oral thrush. It can be quite painful. Once it gets a grip, it can be difficult to treat. Pain, burning feeling in the mouth, cracks. Look how dry that tongue is, red. Or you could get a coated tongue as well, which I'm sure you've seen before. We use antifungal treatment. Some of you might have heard of something called nystatin. Please, if you are caring for somebody with dementia, I only know this with my dad recently. Nystatin's brilliant. It really does work, nystatin. However, it's got to be kept in the mouth, rinsed around the mouth by the person who's you treated. My dad wouldn't let. My dad was just spitting it out. So then we had to go on something systemic, which he was able to take as a tablet. So please be aware of that as well. Remove dentures at night if you can. Rinse mouth after meals if they can. This is an important one. Please change the toothbrush regularly. The toothbrush, if they've got a fungal infection, the toothbrush needs changing. For people who are caring for people at home, you could get 2 toothbrushes, one for morning and one for night if they've got a fungal infection, because if it dries out, it will kill the fungal infection. So blue for morning, I don't know, pink for the evening, and do it that way. If they are using an inhaler, it's important we try and rinse the mouth again after that, and good oral hygiene. I always ask if it's not clearing up that staff swab it to confirm what kind of fungal infection it is and what treatment it will be sensitive to. The most important way of cleaning the mouth is the toothbrush. Without a shadow of a doubt, it's the most important way to clean the toothbrush, clean the mouth. So brush natural teeth twice daily with a fluoride toothpaste. we've put, these are the guidelines. If you have got somebody who's quite challenging, even if you could do it once for me, effectively, that once a day, I would probably take that. Ideally, just before bed, because that's when it's most important. I'd love you to be able to do it twice a day. I mean, that would be phenomenal if you could do that. But once a day, I'd take, as long as it's, you know, you are getting it at least once a day and getting fluoride in there. When toothbrushes are old, they become ineffective and harbour bacteria. So we do say they need to be changed 2 to 3 months for you and me and whoever. And sick people are advised to change the toothbrush at the beginning of an illness and when they're better. Somebody said to me on a talk recently, well, my mum's never going to get better. No, but she might get D&V. She might get diarrhea and vomiting. Change the toothbrush after that. She might have a cold. I always change my mum and dad's toothbrushes and denture brushes if they've had a bad cold. I did with COVID. I would change their toothbrushes. So it's just a little bit of common sense. Emma, can you see me on camera?
I can.
Yeah. So this is, I always use a very small a small headed toothbrush. This is a baby head on a long handle. If anybody likes some of these, I know the guy who does them, so I can send you one to try. I prefer a smaller head. It's just so I can get in easier. There are others. Dr. Barnum is a 3-headed toothbrush, so you go in and you're actually doing 3 surfaces at once. They are really good as well. We can put grips on them if they're struggling to hold toothbrushes. I've got one who's got a tennis ball over it so they can grip it better. And believe it or not, some people with dementia prefer an electric toothbrush. They quite like the vibrations of it. So there's plenty of toothbrushes out there. I would go for, if you are brushing somebody else's teeth, and even if they're brushing their own, I'd go for a nice smaller head and a medium, nothing too big. As we get older, our skin becomes transparent. I've seen it with my mum's hands at the moment. Her skin's gone thinner. As we get older, it's happening to me as well. That happens in the mouth as well. So if you're brushing somebody else's teeth and you slip or you're a little bit overzealous, you can actually damage inside the mouth. So be nice and gentle. I don't want to put you off, but just be aware of what you're doing. We do regular audits within care homes, and this is why. This is some of the pictures that we found. I mean, you can see that toothbrush, both these sides of the toothbrushes, they have not been rinsed. They've just been left on the side. Look, that's a tray that oral equipment was in, and that was the mouth of somebody who's actually got some abscesses there. So it just shows why it's important to regularly look at our equipment that we're using. I would rather them not use those brushes at all than use those. And they're harbouring loads and loads of bacteria. There was a study done at Manchester University years ago that they said there was more bacteria and bugs on a toothbrush than a toilet seat. So just bear that in mind. It's a nice study, wasn't it? I'd like to have carried that one out. Periodontal disease. You'll see, if any of you've got young teenage kids, I remember my son with gums like this. He'd go and brush his teeth, but the brush was never touching the actual gums. Periodontal disease, bleeding gums, is bacteria in the dental plaque. It causes gum disease and swelling and bleeding gums. Do you know what? Sometimes, and it causes loose teeth after a while. Excuse me, police cars going by. Sometimes bleeding gums can frighten the carers. If you've ever been brushing somebody's teeth and it starts bleeding, it can really be quite scary. However, it's the only place in the body that we're saying keep aggravating it. So if you had a wound anywhere and it was bleeding, you would leave alone. It's the opposite in the mouth. You need to keep brushing to get the bacteria away. And after a while, it will tighten up. So basically, I'm asking you to brush where the teeth meet the gums. They'll bleed. Honestly, they will. And even me, my oral health educator, has had bleeding gums. But eventually it will stop. To be fair though, if you've got somebody with a mouth like that, whether it is your relative or a patient or a resident, I'd want that referring on anyway, because that's quite challenging. Maybe consider a referral for a dental referral. I'll go into that. I'm smiling about dental referral. I'll go on to that later. Toothpastes, quite important this actually. So when I'm brushing people's teeth now, whether it's my mum, my dad, or people on wards, I use a non-foaming toothpaste. If anybody wants to get in touch with us about a non-foaming toothpaste through Emma, please do, and I can give you more advice on this. So it's called sodium lauryl sulfate. Some of you might have heard about it before. It's the foaming agent in toothpaste. It's in DAS, it's in Fairy Liquid. I like foam. I prefer toothpaste with foam because I'm being conditioned to like foam. But for people some people can't take foam. I need to be able to see what I'm doing when I'm brushing somebody else's teeth. So it makes it a lot easier. Also, all the guidance says make sure that they don't rinse after brushing and spit out. My mum's losing the ability to spit out now because her brain's not telling her how to spit out. So with a non-foaming toothpaste, you do not have to spit. There's nothing there. What I'm trying to do is empower you to be able to brush teeth, because we say, oh, just brush the teeth, brush near the gums. We're making it out to be dead easy to do. It's quite difficult to brush somebody else's teeth. So please consider a non-foaming toothpaste. You might have a relative who's on a high fluoride. I don't know if I've got a picture of it now. You might have a relative on a high fluoride toothpaste. I'll say the brand, Durafat. If that's been prescribed, they need to stay on that. But that has got a foaming agent in, because it has to have a foaming agent in. We also know of unflavoured toothpaste as well, that are unflavoured and with no foaming agent in. They're pretty handy as well, because believe it or not, people with dementia sometimes mirror people with autism. They have sensory issues. So if you pop some mint in their mouth in a toothpaste, they can get a sensory overload and they don't like it. Also, burning mouth. If you care for anybody who's got Parkinson's, the levodopa can give them a burning mouth. So putting in a foaming toothpaste with a flavour can actually make that worse. So it's just little tips, but take nothing else from me today. Look for a non-foaming toothpaste. There's plenty out there now. I think Sensodyne are removing the foaming agent out a lot of their toothpaste. But if anybody would want any more information on that, I'm sure, Emma, they can get in touch with me, or we can help you out with that. Okay, so we're now on to mouth care for residents with challenging behaviours. I know it can be difficult to do with somebody else's oral care. Trust me, actually trying to brush somebody's teeth, if you go to the hygienist, it can be, you're a little bit hesitant about it. So coming at somebody with a toothbrush in their mouth, in their face, can be challenging. I probably wouldn't want anybody doing it with me. I want you to do a calm and kind approach. The Admiral nurses say to maintain eye contact. I will always suss out the person before I come at them like that with eye contact. I know with some of my residents and patients who are autistic, they want to see the whites of my eyes. However, other people don't want to see me coming at them. So you've got to know your person, your resident, or your loved one. Choose a location where resident most comfortable. Bedroom, bathroom, car park. I've done oral care in the car park before now. And it's a true story. Ask family or carer for assistance. They're the people who know them the best to do. And they will give you some tips as to how to do it. Try different times of the day. We're conditioned to do morning and night. I've explained why night's important, because of the bacteria in the mouth, and the mouth's dry during the night, and the bacteria during the night. But if we can do it at another time of the day, that would be great. And try different times of the day. Short burst, distraction techniques. We sing, we put music on. We'll let them watch Emmerdale or Coronation Street while they're brushing their teeth. Familiar toothpaste and toothbrush, very important. And also I've mentioned your non-foaming and your flavourless. And here's a video which I thought might be some help with some tips on how to brush your teeth.
So here's a middle, so you right-handed or left-handed? Right-handed. Okay, so turn this way a little bit so everybody's going to be able to see us. Now, before I had to do hand under hand, right? Now what you're going to learn how to do is be the fine motor when they're losing it. The tool manipulation. So the reason I want her hand is her brain remembers her hand coming to her mouth. The reason I need my hand is she doesn't know how to manipulate a toothbrush anymore. So what I'm going to do is do the toothbrush. She is with me, and by being over here to the side, guess what? She literally thinks what? She's brushing her own teeth. Notice that I have my hand on her shoulder applying downward pressure. I'm tricking her mouth into not paying as much attention. Now you notice Emilie's a little bit tender around here. She's not real fond of this. But let me take away the hand and watch what happens. Much more intense, because I'm actually tricking her brain. This is close and it's proximal, and so I'm actually tricking her brain into paying attention to the pressure on her shoulder. Now watch this. So does it make a difference? Yeah, so I want each of you, and here's the deal. If you're going to be really good at this, you have to master both sides, because you will have residents who are opposite dominance of you. And it doesn't matter what your dominance is. You have to use their dominance unless they've had a stroke, and you may have to use the remaining side. The reason you want their dominant side, that's where all the brain history is for fine motor tasks. Only 1/2 of your brain has learned fine motor skills. The motor memories are not available on the other side. And so I've got to be on this side. It's also where it's going to draw her eye. Search and rescue will always tell you, if the right person is right-handed, they'll make right-hand turns. If they're left-handed, they make more left-hand turns. It's an automatic behavior of the brain. So she will look at me more and pay better attention if I'm on her dominant side. So with your partner, give it a try. Try it out.
I've used that technique quite a bit. I've also used it for other things like feeding, and it is a distraction. It either works or it doesn't. I would ask you to be patient, and it makes complete sense what she's saying there. Also, another thing I do before oral care is I'll desensitize their face and lips, getting them used to my fingers before I actually perform oral care. I'll put the gel on the back of my hand. I'll obviously wash my hands before. Gel on the back of my hand. I'll do the desensitizing technique. If they will let me, I will apply some of the gel to their fingers. If not, I will fool them into thinking it's them that's doing it, and then I will go on with the toothpaste. I actually put the toothpaste on the back of my hand as well, because I don't need to wet it, because it's a non-foam. It doesn't need water. So that goes on, rather than popping it on the brush, because it can drop on the floor, if that makes any sense. Plenty of little tips on how to do that. I think the one thing to take away is to keep trying, is to really keep trying. I have to, with being a mouth cancer ambassador, and please, this goes for you and me. Yeah, we're talking about the elderly here, but this goes for all of us now. Please check your mouths out. Without oral care education and promotion, oral cancers in the older person could be missed. A lot of mouth cancers are in the over 65s. This is a Rochdale care resident, home resident, 92-year-old female presented with a rapid growing mouth cancer. These images were taken 3 days apart. So it's important when they're yawning or they're shouting or they're laughing that we have a look in to see if there's any bumps. Just because they're elderly, just because they may have dementia, cancer doesn't go, I'm not visiting them because it's going to be a nightmare. It still does. And we are seeing quite a few actually in the care homes close to me. So please, please, please keep a note. Have a look inside, as you would look if there was a mole changing anywhere else in the body, or they had a lesion that wasn't healing. Please, please, please look out for a non-healing ulcer. Together with Rochdale Public Health, we've developed quite a few tools. These are little pocket guides here, the blue one and the green one. Again, if anybody's interested in those, let me know. They're for care staff. There's some educational bits in there, the little pocket guides. They're really, really useful. And we've done a look, listen and observe for mouth cancer. Just let me get this up. This was a video. We realised that you can't do a screening like you would normally do for mouth cancer with you and I. It can be hard. So we've done a video here for the care home. So I'll just play this for you now.
Oral hygiene is important, whatever your age, but as we know, that 78% of mouth cancers are now occurring in the over 55s. It is really important that care home residents are looking after their mouths, and care staff are looking out for the signs and symptoms of mouth cancers. Regular assessments of the resident's oral cavity is really important. The ideal time to do this is when you are brushing or caring for your resident's teeth or dentures. If your resident is comfortable with you performing their oral care, this is the time to have a look in the mouth and see if there's been any changes by asking them to stick their tongue out, looking under the tongue, if they're able to, into both cheeks. When looking in the mouth, it's a good idea to have a pen torch. You're looking out for an ulcer that maybe hasn't healed over 3 weeks, tooth that maybe is unexpectedly loose, maybe an odour as well, or the denture isn't fitting correctly. Once you've done that, have a look at the face, have a look at the skin. Are there any bumps, any lumps that have appeared, or any moles that have changed shape or colour? This is the time to make a record of this. Now we know that providing oral hygiene care and performing these oral checks might not be straightforward. Some residents have some complex needs. We do know that nearly 58% of people in residential homes have got dementia. In these cases, we encourage staff, relatives and loved ones to use the look, listen and observe method. You know your resident. Look out for any subtle changes. Is there an odour coming from the mouth? Is the resident drooling all of a sudden? Are they losing weight? Listen to their voice. Is it hoarse all of a sudden? Or are they complaining they've got something stuck in their throat? Always look. Are there any lumps or bumps evident around the jaw or around the mouth? Any moles changing at all? These are all signs of a potential problem inside the mouth. In situations where the resident can be a little bit reluctant to have oral care provided or an oral assessment, we can either try a different time of the day, maybe, or look at some of the distraction techniques, which are really helpful. Meal times are a great opportunity to look, listen and observe your resident. If they're struggling to eat or drink, this needs documenting and raising with the senior person in charge.
I've got to give Peter a shout out. Peter was the resident there, and his acting skills were absolutely brilliant on the day. That was a residential home in Rochdale, and they were. We thought it was a really, really important video to make. It's Mouth Cancer Awareness Month in November, so I am going to be hopefully asking Emma if we can do something with Age UK on promoting mouth cancer awareness, because it's so important. So in conclusion, I've gone on too much. An oral care assessment should be completed within 48 hours of admission. So if you're a relative who's been listening to me today, please make sure this has been done. The management of a dry mouth should be included in the patient's oral care plan. Mouth care can be carried out as often as necessary to maintain a clean mouth. Prevent cracking, lubricating gel. If patient is on an oxygen treatment, a water-based solution. I use Vaseline on my lips, but Vaseline actually sometimes seals in the dryness. So one of these lubricating gels is probably better for the person. Obviously, we're all faced with this at some point, and I will be with my parents. Who knows when they will end? They'll be in the last days of life. It'll happen to us all, unfortunately. But the mouth is so important towards the end of life, and these gels are so important in that looking after the mouth and keeping the mouth lubricated. So let me end this now.
I can just bring us back here like that, Em.
I just wanted to, before I went, look at, we've done a QR code and I can send these to Emma and send the link. What I wanted to do, there's a lot of complaints about mouth care. People say it's not been done, or it might have been done, but sometimes you do mouth care and you go to the door and you look back and you think, my God, it's gone dry again. So what I thought we should do is empower the relatives and the carers to maybe look in the mouth and get them to maybe be involved in mouth care. That was just my thought on it. So what we've done is a little video. If you scan this QR code, it's me talking to the camera like I've done today. It's not evidence-based, it's not technical, but it's me talking to you about how to keep your loved one's mouth clean, about the gels, about the toothpaste, especially if they are sort of palliative, which my mum and dad are palliative. They are palliative, and I'm trying to keep their mouth healthy because I want to kiss their face to bits when they pass. I'm right there. My dad will probably tell me not to, but I don't want them to have a dry, crusty mouth. I want them to die with a lovely, lovely, healthy mouth, and those lips to be pink and moist. So these QR codes are quite, I think they're useful, but I'm going to say that because it's my mush on them. But I'd love to send some out to you, and we've put them in the hospice. We've put them in Bury Hospice and Spring Hill Hospice in the rooms, so when the relatives are sat there, they can scan this, have a look at the video, and then think, I'm going to have a go at that, or I don't want to have a go at that. So there's no pressure on them to do it. But I just thought it was trying to get, if they know why it's so dry and they know they might understand how challenging it can be for care staff as well. So I hope that's been all right, Emma. I know I'm not taking a breath yet. I hope you can see my passion for it, and it's so important. It is so important, and it's not an easy thing to do with oral care. Oh, thanks, Chris.
That's brilliant. I was going to say Chris will probably want some because he looks after care homes in Salford, so he will definitely want some leaflets. I've scrolled up because Anne had a specific question, and I think you've answered some of it, and I don't know if we need to think about the other element. So how do you get a resident of a care home who has dementia and Parkinson's to open their mouth?
You do the distraction techniques, and I hope by just getting them used, they have still reconditioned. Oh, let me put it like this. So my mum's we've got time, haven't we? My mum's a dental. I have mentioned my mum's a dental nurse, right? But she still does not like me looking in her mouth. My dad, I go to look in his mouth. His long-term memory, his bookshelf with dental, going to the dentist, is still there. And that book is horrific. It's a horror movie. It's a horror book, that book, right? Because it was a very bad experience at the dentist. So all these other books have gone that were great visits. That one's still there. So every time I look in his mouth, he's transported back to what dentistry was like back then, if you're following me. I'm not saying it was always like that, but it wasn't brilliant. So sometimes they can be a little bit hesitant about it. I would start with the desensitization and getting them used to that and reinforcing it. I'm not saying it's like dementia where you're trying to retrain their brain to it, but the more often they do it, I know they might forget it the next day. I want you to keep trying. And even bobbing a bit of the gel on their lip, and then they will lick it off. Yeah? Take your time with it. If there's anybody you want me to come and see, I shouldn't really say this, but I'm going to say it because I'm in a good mood. I will come and give you some tips on how to do it, or I'll talk you through it, or we can have a conversation about it. But it's techniques, music. I do think the desensitizing technique and getting them to hold your hand so they think they're doing it is better than straight in. Oral care to everybody is toothbrush, toothpaste, and in the mouth. Step right back, put your toothbrush down. I hope I've proved it's not just about this and the toothpaste. It's about the whole of the oral cavity, and it's about your approach as well. And treat them with respect, which I know you are doing. One last thing for us carers is patients and residents know whether or not A, you want to do their oral care, and B, if you're going to be good at it. They sense that. So if you're like, come here, I want to do, they straight away, you've had it. I'm not saying you're going to run in going, I'm coming to do your oral care and I can't wait. But they pick up whether or not. One thing my mum still got is she knows that I love her and I want to care for her, even though she's losing who I am. She feels that from me. That's why in every home there's always one person who can get in the mouths of residents, and it's normally somebody who wants to take the time to do it and give them that respect. That makes sense.
Thanks. It's Beanstalk House. Thanks. I think Chris wanted that, so he's got that. And I think Beanstalk is in Salford as well, is it not? Anna just added on there that her husband's not had any dental care for over 4 years, and she's not been able to get any dental care into him. So
is this Salford? A community dentist?
It is Salford, yeah. But I think Chris is going to pick. We have been in there, but we're waiting. Right, okay, Chris, you're going to pick that up. If Chris picks that up, and if we don't get anywhere, come back to us, and we've got like superhero that we can send in. I'll just have to meet her and buy her a coffee afterwards. Yeah.
Dentists are struggling with dent. It's not just in Salford. We're having it all out. It's national. It's a national thing, and I'm obviously a patron of a society of dental nurses. We're trying to get more dental staff going into care homes, but it's about insurance, it's about competency. It's not as easy as that, and also training on how to treat somebody and approach somebody with dementia. you know, I've done loads of courses on dementia. Oral care approach doesn't seem to be. It's all about the brushing, and but I think the approach is as important as what we're using, if I'm honest.
Well, if you're talking about an empowered conversations approach, Anne, you've been on the courses. Every tooth's got a thick plaque all around it.
We need to get in there. Is his chest okay?
Well, Anne's yes,
that's
chest
okay.
Is okay.
Good. Sorry,
when you were saying about recurrent chest infection, we've got a caregiver whose mum is end of life and has got a recurrent chest infection. And I just thought, oh, oral care, because she is on, you know, she's on sort of shakes and ensures and whatever. And I did wonder about that, so I'm going to mention it to her to check.
We're involved in training in Rochdale and Oldham, and in the Rochdale care homes, we've seen a reduction in admissions with aspiration pneumonias and chest infections by keeping the mouth clean. And it's like, wow, that's interesting. We've known about this for absolutely years, but it's not easy. They're challenging, these residences. But if you I went round one home, and there was a lady being shown around as a new starter, and she was going around and she said, she needs this. Don't even bother with her. She won't let you do her oral care. We've got to get rid of that narrative. We've got to get rid of that. You keep trying. There might be some glimmer, or they recognise somebody's face might remind them of somebody that they'll let them do their oral care. I think that's a message for me, is please keep trying. It's not easy. But if it was the eyes, we would do something about this. You don't get bitten with your eyes.
So, and if Chris can't sort this, what I'll do is I'll make sure I'll share your email with Chris so that he can contact you direct. And if he's not able to get that sorted, then we've got a B plan, Anne. Okay.
Oh no, Deborah.
Oh, okay.
No, she's brilliant, Deborah. Yeah.
Brilliant.
She's just an event with one of my team. I like Deborah.
We could share this out with people as well. You know what I was thinking then when we were learning all about the parotid gland? Did I say it right? I've written it down because I thought, well, when you're having your ensure, how much better would it be to be having your ensure when you can smell food? Because then that gland should have kicked in, so that when you have your ensure, then it should be easier to go down. Is that right? Is that a good idea, Em?
It might frustrate them a bit. It might.
Oh, because they can't eat it.
It's worth a try. But as I was mentioning that, all your mouths will have started getting. You start thinking of food, and your mouth starts filling up from the parotids. So, can you imagine not having any saliva in there all day, every day? It is really awful. It's very debilitating. But it's one of those things. By the way, GPs are sometimes a little bit resistant to prescribe lubricating gels. They'll tell them to take a sip of water. I can be a little bit. I get a bit cross with that, because then they're up on the toilet all night because they've drank too. But it'll quench their thirst. It will not lubricate the skin. So please, whatever gels are out they want to prescribe, get them to prescribe a gel. They would anywhere else on the body. They would prescribe a treatment. It's a condition, a dry mouth. Oh, I got all serious then.
You did get really serious. I was thinking, is there this element? Oh well, they're end of life. What, like that sort of. Oh well, what's the point?
I think, and that's the most crucial time to do it, because there's nothing else. Have I got time to do one quick? I actually lubricated the mouth of somebody who'd passed. And it was a teenager, as a young adult, and the mum said to me, "You've lubricated, his mouth looks moist." And I said, "Yeah." I said, "I've given it a quick lubrication." She said, "I was the first person to kiss those lips, and I'm going to be the last person to kiss those lips. Thank you so much." That's how much a moist, clean mouth means to people who are with people who are passing.
Oh, Ed, you got me going on that one. Oh,
anyway, back to lubricant.
You know what I did realise though, when you said about the lemon, I was like, oh yeah, my mouth does really hurt there. When you have a lemon or one of those like tarty sour sweets and it batters here, and I understand now it's my parotid gland kicking in.
And it can also, by the way, folks, there's a little duct that comes in the cheek. So if there's no saliva going down it, like a little hose pipe in the mouth, bugs can get up it.
Oh. And
then they get an inflammation in the parotiditis, where they get sore parotids. So There's loads of little things going on, and that's just from having no saliva. Get them some lubricant in there, and especially towards the end of life. If you are blessed to be there at the end of somebody's life, which I feel honoured to do, this is a little thing you can do, and it's a massive thing. It's what makes us human, saying goodbye like that. And if you can pop some gel on the lips and they can smile when they go, because they do sometimes, it's so powerful. And if you can't get hold of lubricant, olive oil or a bit of butter.
Yeah. Anne's just saying her husband's not verbal, so she can't say if he's got any problems. But yeah, I mean, from what you've described, Anna, I think he has got quite a few problems going on there.
Thanks, Chris. It should be. We're training all of NCA, and we're involved with the palliative team at Salford Royal as well. So we've done all that. Chris, while I've got you, we've done a grading tool as well. There's been a lot of complaints of patients who are end of life or palliative, going from one place to another, from a hospital to a hospice, or that. So we've done a grading system 0 to 4 on how to grade the mouth, clean, blah 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 blah. So if you'd like that, because that's going to be rolled out through NCA as well, we're using it in the hospices. I just wanted a simple tool. It's a grade 2, it's a grade 3. That was it, with pictures. So if you want that, I'll send you over that as well.
I think we want everything, Emma, please. Can you send us everything? Actually, I did notice, so my mother-in-law was end of life at Salford Royal, and they were all over hair oral care. They were coming in on a regular basis, you know, and I was just like, oh, that's a bit strange. Now I understand, but at the time I didn't understand. But yeah, so it obviously made her more comfortable.
They're really on it. Deborah's team, everybody's, you know, they're really on it across. But we have got problems within every hospital trust at the moment with oral care. We know we need to do it. It's training, it's resources, and often oral care takes the back seat because they are busy. They've got an awful lot to do, but it's the one thing that if we keep it moist, they're going to have less problems towards the end of life. And I know me and you we'll get a bit upset towards the end. You know, it's a horrible thought, but I just want those lips. It's dead easy to keep those lips moist. It's not hard, this. And often towards the end of life, even with dementia, hopefully they'll be in a calmer state if we've done our job correctly, and then we can apply these gels. So yeah, QR code, video on how to do it. They're all there. So for everything we've got is free. And Rochdale Public Health, I've got to shout out Rochdale Public Health. They've been brilliant. They've really supported everything we've done.
That's amazing. So you're going to share all that with me, and I can share that out with everyone.
Loads of stuff in an email now, Em. Sorry.
Yeah, loads. Thank you so much for that, Emma. It's just fantastic webinar. I knew it was going to be a fantastic webinar, and it was a fantastic webinar. So thank you so much for giving your time today and answering those questions. I think everyone else really enjoyed it.